Good afternoon.
Hello.
Paul. I am orthopedic surgeon Aurimas Širka.
Nice to meet you.
So how are you?
Not too bad.
Not too bad. So about your both knees. So as we already have previous conversation online consultation, so you have problems in your both knees.
Yes.
And we had discussion about the bilateral partial knee replacements in your both knees. So could you please explain me what type of the symptoms mainly you feel?
Mainly pain here when I've been walking for about 20 minutes. I get a lot of pain on the inside here. And if I'm standing on one spot for maybe 5 to 10 minutes, I get a lot of pain.
In the medial side. But the pain is mainly located in the medial side,
Yeah.
not in the lateral side.
No.
And you're just active passive movements when you are sitting on a chair, when you're watching the TV, so you don't feel the pain in the middle.
No pain when I'm sitting and lying in bed, no pain at night. Just standing and walking.
Did you, for example, if we compare your last 3 months or half year, did you need to increase the painkillers, dose of the painkillers, just to do your daily physical activities?
The consultant back home told me that the meloxicam, it's an anti-inflammatory and painkiller medication. It was no longer effective.
Yeah.
And he says that maybe if the pain was becoming unbearable, I would maybe have to ask my GP for morphine patches.
Yeah.
But I never
used.
asked for that because I didn't want to start taking morphine patches.
Okay. And what about the intra-articular injections? Did you have experience?
Never had no
So
injection.
it's good because when we are talking about the knee replacement, when we have to talk about the artificial implants in your knee, so it's good that you don't have in short period injections because it's increasing the prosthetic joint infection risk 2 times higher. So it's good that you don't have this performed in your country. So now I want just to look in your clinical examination. Can you first of all, so which leg is worst case scenario for you? Or is both?
Some days this knee is worse. It started in this knee about 15, 16 years ago.
Yeah.
And I had keyhole surgery and they removed
What kind of a surgery?
keyhole.
Keyhole. But also the meniscus, medial meniscus also was removed?
Part of it, there was a tear and
And you had arthroscopy.
the cartilage they trimmed.
Can you flex the knee? So it was performed arthroscopy. It's really not visible scars.
No, that was 15 years ago.
I just want to make an examination. So you see, for example, I don't know whether you already saw that your legs becoming a little bit bowed.
More so, yes.
And this is it's good that you had already a consultation in your country, my orthopedic surgeon, who is, for example, I hope he's performing also partial knee replacements. Yeah. Because the main keystone about the successful procedure of partial knee is the good candidate of the patient and selection of the patient for this partial knee. Because I see that your varus deformity is correctable, so it means that I can put in a neutral position with your right leg, and also the left leg also it's correctable, so it means that this deformity, which comes just from the medial part, arthritis, so we have no cartilage at all in the medial part, and also it's well visible in your both knees x-ray, so that we have in the medial part bone on bone defects. Also the lateral x-rays shows the same findings. Also what is well seen in the x-rays, also during testing, that your ACL ligament, because in the knee we have 2 ligaments, the main ligaments, so it's posterior cruciate ligament and anterior cruciate ligament, so they are both intact. So it's very important that we have the both ligaments intact when we're talking about the partial knee replacement, because we have the mobile bearing between the femoral and tibial component, and for the stability we have to have both ligaments function. So it's good, and also all the indications, X-ray and also clinical examination shows that you are a good candidate for the partial knee replacement. About your bone quality, from the X-ray I see that it's good bone quality, it's visible, and my plan during the procedure is to use in your both knees cementless, so it means uncemented partial Oxford knee. So partial Oxford knee is the most famous partial knee in the world, and it's showing best survival results in according to all the joint registries, and the biggest joint registry is from United Kingdom and Wales registry. So the quality of the implant is the best what we can have still nowadays in our orthopedic world. So I'm planning also to use for your knees this type of implant, and uncemented. In some case scenario, also during the procedure, I will see that the uncemented, cementless component won't fit due to the sclerosis of the bone. So we just have to use the cement, make augmentation with the cement, and to use the cemented components in order to have the best primer stability in your bones. Do you have a question for me?
As the rest of the joint and my
the
knee,
lateral side, the patella joint, because in the knee joint we have two joints. So it means femoral tibial joint, which goes here, and also the patella, the small bone from the inside itself, it has the cartilage. So from the x-rays, in the right knee there are some signs of the patellofemoral joint arthritis, but it's this type of arthritis does not have any contraindications for the partial knee replacement. In previous, before 10-15 years, it was contraindication, but nowadays it's not contraindication. So because we have bone on bone in the medial part when we are restoring the axis, and when we are replacing this damaged part, so the patellofemoral joint goes.
Okay.
Incision will be short incisions from the medial side. Here it's around 7-8 centimeters. Sometimes if it's not well seen during the procedure, all the bones, sometimes we just need to extend this proximally. So the incision could be shorter or longer, but surgeon should see all the bones that is necessary to make a good implantation of the artificial joint. Weight bearing regime, so you won't have any limitations. You can walk with a full weight bearing immediately. Of course, the pain, because we will perform the both knees during one procedure, so the pain will be, I cannot lie you, and it's necessary to understand that the painkillers will be mandatory for you, especially the first 2-3 days. And the doses of the painkillers also will be higher in comparison if we are doing just one knee replacement. So it's all the time the pain management protocol that we have and what we are using here in clinic, so it's not a problem at all.
and the range of movement in my leg, will that improve?
Yeah, of course.
Because I can only go
Yes.
from here to here. When I was going to yoga classes, people could put their heels back.
Range of motion also increase, but increasing in time. You won't reach these movements through first 6 to 8 weeks, no, also true, but also it depends how you will perform the physio, how you will perform and how you will enhance your muscle strength. So this partial knee replacement allows the native knee movements. So it means 140, 155 with normal range of motion from a native knee, non-operated knee. So you, of course, with this partial knee replacement, you can gain your normal movements. And also the extension that what I see. So the extension is full. A little bit also you have some lack of the extension on the right. And on the left, it's full extension. So here you have some extension deficit. It's flexion contracture, but this flexion contracture just comes from anteromedial arthritis. So when the arthritis will be missed, so the extension will increase.
Good. Yes. Thank you.
So it was my pleasure to explain you. See you in the
Nice to
operation
meet you.
theater.
Thank you.